My name is Gnahoui-David. I'm coming from Benin, and I work with Plan International in Benin. I would like to share with you our experience on how expenditure are made for HIV AIDS and what conclusion can we have with it. The presentation will be done in 5 points. We talk about the objective after the presentation of the country, the methodology we use, and talk about the finding and make a conclusion. Benin is located in West Africa, between 4 countries and the sea in the south of the country. We have a total population about 10 million of inhabitants, and the situation in relation with HIV/AIDS is the one you can see. The prevalence in general population is about 1.2, and you can see that population like commercial sex workers, men who have sex with men, and the injection drug user are the ones who have the prevalence, the highest prevalence in the country. We would like, through the presentation, to analyze the resource flow for HIV response in Benin, to determine the level of expenditure for HIV response, to measure the use of resources for subpopulation, and to generate key information for policymakers to use in strategic decision making. What is the methodology we use? The methodology is based in national AIDS spending assessment, which has 3 dimensions based in financing, delivery service delivery, and service use. This methodology has 7 categories of expenditure, which are prevention, care and treatment, orphan and vulnerable children, program development, human resource, research, and social protection and social services. What are the findings? We see that resources for HIV increased from 2010 till 2012 with a drop in 2010 because a lot of partners stopped the financement in 2010, and only the Global Fund could provide funding for Benin. Between 2001, 2011, and 2012, we can see that there is an increase of the public fund in relation with what's happening with international partners. In relation with the financing agent, between 2011 and 2012, the public fund increased also. There are international partners who give money to the government, and the government finance the activities. That is why there is that situation. According to the service delivery area, treatment and care are the service delivery area where a lot of expenditure was made. And also we can see that prevention have a good rating, and management and administration of the program have the highest rating in this expenditure. According to the targeted subpopulation, people living with AIDS are the one who receive the highest rating, And we have 33% of non-targeted initiative. Analyzing these results, we can see that between 2011 and 2012, targeted population such as men who have sex with men, commercial sex workers, and injection drug users receive less money, but there is an increase between 2011 and 2012. People living with HIV AIDS also, there is an increase of the expenditure made for this population. But the funding should reflect the weight of the contribution in the epidemic in Benin. We saw in the first that commercial sex workers, injection drug users, and men who have sex with men those people are the one in which the prevalence of HIV is high. But the expenditure did not reflect that epidemic situation. According to the target population in 2013, people living with HIV/AIDS receive the most important part of the expenditure, and there is a situation better than what we observed in 2012, because based on what we receive, in what we noticed in 2012, we decide to put more focus in the targeted population, and there is an increase in what is used for those populations, but is still low. In conclusion, we would like to say that policy makers and program implementers have to understand that the resource need to be allocated and recognize the trend in funding, and to begin prioritizing resource allocation for key population. We need to move with the epidemiology of HIV/AIDS and allocate funds according to the situation. The evidence from NASA was used for the following realignment of programming based on the United Investment Framework. The Benin Strategic Plan against HIV was refocused on the key subpopulation, and the support planning and implementation for initiative targeting key population is done. Thank you for your attention.